Hey everybody, it's Jamie here, and today I had my surgical consultation for my jaw surgery relapse. And before I get into that, I just wanted to talk about commenting on my video. So you may have noticed that I turned off the comments on my most recent video, and the reason for that was just because there were getting to be so many that it was overwhelming for me. I think when I shut off the comments, there were about 160, which obviously is not a crazy amount, I know, and several dozen of those were me responding to people. But I mean, I'm not an internet famous person, and every time I opened my email, there were more and more comments from people, and it was just getting to be overwhelming. Like I'm not used to that, and I'm not used to having like constant input about the things that I do in my life. And yeah, I needed to shut it off for my own mental health. Um, there were several very nice comments from people, wishing me well and telling me that they felt that I had to go through this and everything, and that they'd been watching my videos and were sad to see I had to go through this again and whatnot. And so if you left me that kind of comment, I just want to say thank you, and I do really appreciate that. I think about those comments sometimes and about how nice it is that there's people in the world wishing me well, and it makes all of this less crappy, so thank you. But there were also several comments of people trying to give me medical advice or diagnose me, or just kind of argue with me. And I just want to make it clear that I am not asking for medical advice in these videos. And if you try to give me medical advice, I will probably just delete your comment. I'm not interested in that. I'm in my late 30s. I know better than to take medical advice from internet strangers. And you haven't even seen my x-rays or anything like that, and you're probably not a doctor. So to be honest, I really don't care what internet strangers have to say about what they think I should be doing. And I also want to make it clear that I am also not a medical professional, and I can't give you medical advice. I can't tell you if you're going to relapse. I can't tell you if the same thing that happened to me is going to happen to you. I really just make these videos so that if you're going through the same thing, you can kind of use my experience to help you go through it. But I think that if you have, concerns about relapsing before getting jaw surgery or even after, that you need to talk to your doctor about that. You can't watch my video and try and figure out what's going to happen to you based on me, because it's so individual. Anything can happen. And honestly, I've been thinking about my whole process since all of this kind of resumed. And when I had my 3-year post-op my 3-year post-op appointment in 2018, I remember they looked at my mouth, or the surgeon looked at my mouth and everything. He was like, yeah, you showed no signs of relapse. Everything looks great. Your joints look great. So, it's so hard to say what's going to happen. Like, no one can tell you, but I do think that your own surgical or medical team is the best people to be talking to about it. I can't tell you. And if you ask me, I can't answer. So probably don't waste your time asking me. So also, when I shut off comments for the most recent video, I started getting a lot of comments on the most recent video after that, and eventually I had to shut that off. And then I started getting comments on even older videos. And so I'm going to leave comments open on this video unless it becomes overwhelming again, at which point I'll just shut it down. So if you are watching this video and the comments on this are shut off and you just have to tell me something or you have to ask me something, please keep in mind that I do find it really overwhelming, like getting all this input from people. And so please just be respectful. I'm a human being and I'm doing this to help people. And so, yeah, just please keep that in mind. Okay, so now that that's out of the way, I had my surgical consultation this morning, and the surgeon was over an hour late, which really sucked. I should have seen it coming, but I didn't, and I was so hungry waiting for him to come in, and I was also just getting so nervous, just the anticipation of it. And it's kind of funny, I really don't like navigating hospitals, like especially by myself. I am directionally challenged, and the hospital that I went to is a major giant hospital, and they took my blood pressure when I checked in, and it was way higher than it normally is. Like, I generally have low blood pressure, but it was like 140 over something, and I was just telling them I was so scared I was going to get lost. Yeah, so he did finally come in with a resident, and they asked me some questions, and they looked at my bite and my range of motion. And I also had an old x-ray and old panorama from 2013, before I had any surgery at all. So he was looking at that and saying that because of all the problems that I had then, it's kind of not surprising that I relapsed. So that was kind of interesting to hear. And we kind of looked at my left joint, which is the one that's in worse shape, and saw how it has seriously, like noticeably degraded since I had all the surgeries. And it's worn away, it's flattened pretty bad. Yeah, so anyway, so it sounds like it's going to end up being one of two treatment streams. It's either going to be arthrocentesis for my joints and then revision jaw surgery to fix my bite, or if the joints look bad once we do some imaging on them next month, that I would just end up getting bilateral joint replacement. So I kind of just expected going into this that the conversation was only going to be about joint replacement. So I was a little bit surprised that we even talked about anything else. And I was especially surprised that I might need jaw surgery again. I really just thought this was like, yep, joint replacement, that's it, that's what I need, either unilaterally or bilaterally. Yeah, so I'm very fortunate that I don't have a lot of jaw pain. So it would be nice not to get joint replacement, but if I don't get joint replacement, then I have to get jaw surgery. And like that's major surgery too. It would be a different one. It would be IVRO this time instead of BSSO. And I'm sure that it's very similar. And it's a long, grueling recovery. And, you know, it takes about a year to feel back to normal. And so that sucks. But also, the joint replacement's going to suck too. Like, that is also a longer surgery and a long recovery. And I think it's even an even longer hospital stay than the jaw surgery. So either way, there's some hospital time coming down the pipe for me, and I don't know when yet. Like I said, I have to do some more imaging, and we're going to decide what to do based on what the joints look like in the MRI and CT scan, and then I have to talk to the surgeon again about that. So I would say look for another video from me probably in a month, maybe a month and a half. It's hard to say. I don't know how long this stuff's going to take. So yeah, it kind of sucks not to know after this appointment what's going to happen and when it's going to happen. I kind of expected that I would, although I did tell myself, you know, don't expect that you're going to find out everything from this appointment. But it's hard, you know, it's been over 3 months now, and it's like, I just want to get on with this and at least have a timeline so that I know, and I can start telling, you know, my work and like my hockey team and stuff, like, look, I'm going to be off for a while. So it's really hard to just be in limbo and sort of waiting to find out what's coming for me. So yeah, so that's where I'm at now. It's kind of crazy. My head was spinning afterward. Yeah, it's a lot. It's I don't know if I've really totally acknowledged mentally that I have to go through all of this all over again. Like, I was sitting there waiting for him to come in for an hour and just staring at the exam chair, just thinking like, I can't believe I'm doing this again. Like, this sucks. It really does suck. And I hope if you're watching this that you're not staring down the same experience that I am, because this is not fun. But anyway, if you're still watching here, thank you very much, and look for a video from me maybe in like 6 to 10 weeks. It's really hard to say, but we'll see you next time.